Welcome to You and Your Pets. I'm Jim Horton, and as usual, we're here with our resident expert, Dr. Ernest Rogers, and with a special guest tonight, Dr. Akhtar Hossain. And Dr. Rogers, I'd like you to introduce him to the audience, if you would.
Well, thank you. Dr. Hossain is a physician, and we've had an opportunity to talk this evening. And I think he brings some expertise in the area of psychiatry to the area of animal-human bonds. And I'm pleased to have him here. I offered the invitation, and I'm so glad he accepted. He's also the director of the Somerset Regional Hospital, and he has his own private practice in adolescent child psychiatry.
Okay, so this is an area that I'm extremely fascinated about. Let's give it in the largest dimension, people and their pets. What is it about the psychology of people and their pets?
Well, as far as we know, over 10 to 15 years, we know humans have domesticated pets and playing a very important role in our lives. They have been used as herders, they have been used as a guard dog, even for hunting, and today we know dog has been used extensively in the police department. So there is a great bond between human and pets.
It's interesting to note that dogs and cats
Correct.
have come into our lives and been our friends. I just don't want to forget my buddies who are the cats.
Is there, I mean, is the bond, it's a mutual bond, right? I
Correct.
mean, the animal recognizes something in the human, and the human recognizes something in the animal. That's a correct statement?
Correct. Any bonding, when you talk about bonding, it has a mutual benefit, like, mother with children, or boyfriend, girlfriend, father, son. So same thing, the bonding between human and the animals, that's in psychology, when there is a mutual interest.
Now, we're living in a very stressful era now, particularly for adolescents.
Correct.
But even for grown-ups and parents. I mean, we have a daughter getting ready to go to college, and college application is a high tension time, for example. Is there something about the bond between human and animals that alleviates stress like that?
Absolutely. Well, since 1945, following Second World War, the number of psychiatric patients has been increasing dramatically. The more and more patients we see in the field of psychiatry with depression, bipolar, substance abuse, and so forth. There are multiple factors involved here. It's not just, it can be biological, it can be environmental, it can be, increase the daily stress of our lives. More single parents are raising their children. So there is definitely a lot of stress trickle down to our children from adult to children.
I think some is environmental. From the environment, living the day-to-day, driving on the highways, seeing what's going on in your schools, seeing what's going on the television. I think environmental stress.
Does the cell phone, the iPad, the Twitter, the Facebook, and all that add to the stress?
Absolutely, because we are multitasking. We are not just doing one single thing. While we are driving, we're trying to talk to our children, we're trying to talk to our coworkers, with our wife or husband. So definitely we're multitasking, so definitely stress is involved here.
Okay, now how do pets factor in to psychiatry?
Well, PET has been used, there are a number of studies done, mainly with mild to moderate depression. One study I remember was done in Honduras. They have kind of took 30 patients, and some of them were placed with therapy with the dolphin, and other were just water therapy or therapy as usual outdoors. And after a few months, and they have found there is a huge difference in patients with dolphin decreased their level of anxiety and alleviated their depression.
Okay. And do we have any? Do you have any particular stories, or you, Dr. Rogers, of where the bond between the person and the pet has made a true therapeutic difference?
I actually do, and I just want to say before I tell the story, humans and animals are bonded, as Dr. Hossain said, in a mutual beneficial way. When I see people come into my clinic, it's very interesting to see how the dog is dependent on, or the cat is dependent on the owner for protection, and the owner is there for consolation or for counseling by me. And that mutual bond is so visible in the veterinarian's office. But having said that, I've been many lives ago, when I was a young veterinarian in veterinary school, we were able to take an animal to a VA hospital. We took the cat and put it on top of the table. And one of the VA veterans who was there and hadn't spoken in 30 years turned to the cat and said, "Here, kitty, kitty, here, kitty, kitty." And it was an eye-opening time for me to realize just how much an animal meant to that man who's been locked up in the VA for years and years and years, felt there was no need to communicate with anyone, but would communicate with this cat. Eye-opening, fantastic. 1987, I'll never forget that day. The nurses were falling all over themselves. I didn't know he hadn't talked in 30 years. But that's what came back to us, and we continued our prospects in that area with other animals. We brought cats, we brought dogs, we brought rabbits. In some cases, we know people have brought ponies and goats into hospitals. And all these animals set up a mutual beneficial bond, as Dr. Hossain mentioned.
One incident, I mean, just recently I was reading some studies and also some stories from parents who are raising autistic children, that one mother was telling that autistic disorders, they have kind of deficiency with social skills and communication skills. And this kid was not talking or making any eye contacts. So she bought a dog, and one day she found that the child was communicating with the dog, started talking to him, making eye contact, started petting. So there is a non-verbal communication between human and pets.
What, as a psychiatrist, what exactly is happening there? Is it that the individual who hadn't spoken for 30 years and the autistic child are not fearful, or they see something there that they're above, that they can they can somehow relate to, down to, or they see an equal, or what is it that's really at the root of all this?
Well, very good points. I think that that when you are communicating with a dog or any pets, that that you are not being judged or criticized. Sometimes we find children are talking to the dog, when they're quiet, because they know they will be not judged or criticized, and they feel comfortable to express their feelings. I think the bond between human beings and dog is it's unconditional. It's a mutual respect. And,
non-judgmental.
Non-judgmental.
Now, I noticed, for example, our particular animal is my daughter's dog, and there are times when she just can't hug the dog enough, and I've noticed this with a lot of children and with adults too. There's a need to touch. What is that? What is that?
Well, touching is a warm feeling that your body is kind of feeling the warmth of it can be dog to human and human to dog, and it's a comfort feeling. I can give you an example. There was a kind of study done about that. You talk about the bonding, that they had a bear with fur, and they had a bear with a steel, made of steel or iron, and but the milk was given to that bear, the iron bear, and the little bear went to the bear made of steel, drank the milk, and came back to the bear with the fur, comfortable. so that tells us that how our mind is, that we're looking for comfort, we're looking for the warmth, and so forth.
I remember that study. That's an excellent example of how warmth and comfort can help us. With my background in neuropsych, I want to say it's all chemical, and we know that love is chemical. We know that affection is chemical. We know that a lot of these things are chemical, and I think there's probably a chemical component to it, but it's also nice to be touched. It's nice to touch.
We talk about the bonding between mother and the child, and when they're toddlers and babies, their growth and development, that's what the central nervous systems are developing, and it is stimulated by the warm feeling by the mother. Feel secure, being loved and harmless. That's what helps the whole central nervous system, development of the nervous system.
So that brings an issue of, I think, a very central issue. How important is a pet to the development, the psychiatric development of a child? Is a child deprived for not having a pet?
Probably not. A child is not deprived of a pet because not every child has a pet and they're growing healthy, they're okay. But definitely having a pet, it kind of they have found it improved their self-esteem, and improved their communication skills. Now, for example, if a child, let's put this, a 15-year-old kid walking with a dog, and found to be he is more social because of when he is going out with the dog, he's talking to other neighbors, or they're talking to the dog, and
or cute-looking girls on the block.
That's what I was going to say. Works well.
Right. So they have found people with pets are more social, and found to be definitely healthy. There is a saying of walk a hound, lose a pound. Have you ever heard about it?
We have to take a break, but once we're finished with the break, I'd like to go into this a little bit more deeply. We're here with Dr. Akhtar Hossain, and he is dealing with people and pets, the psychiatry of them, and we will be right back.
Television is a powerful and influential medium that allows different groups the opportunity to produce programming that directly affects their own communities. Public, educational, and government access channels ensure that all people, regardless of race, age, gender, disability, religion, or economic status, have access to local government information and the use of a public communication forum. Make sure everyone has a voice. Support your local PEG channels.
We're back with you and your pets with Dr. Ernest Rogers and Dr. Akhtar Hossain to discuss people and their pets, the psychiatric benefit of them, and also the bonding between people and their pets. Question, how does the use of animal bonding improve a human's life? Big question.
Well, there are many ways, definitely, Dr. Roger can help me with that. By my personal experience, I do have a little dog, and one day we went to the vet with my daughter and the dog and my wife, and we have found so many elderly people coming to the vet with the dog, and the bond between them, it's so unconditional, it's so close to them, and you see that they're barely able to walk, but they're holding their dog and with so much love and affection. So, that's just one experience of mine I can tell you about that.
But that brings up, I think, an issue that we talked about during the break. At some point, you have to put that pet to sleep, or the animal dies naturally.
Correct.
How do people handle that? Dr. Rogers, how do people handle that?
It's a difficult situation, and I don't think people realize what a difficult situation it is for us as a veterinarian. Many of our patients, I've had many patients who I've known for 8, 10 years, who now come in from being a little puppy to being an old man or an old woman, and they're having trouble breathing. But it's not my concern that I'm going to be okay. My concern is that the family is going to be okay. The family often comes in, I've seen grown children, 18, 19, 20, 30, coming in crying. Grown men who are police officers come in crying because their dog is going to be put to sleep. I think the concern I have is with young children. It might be their first experience with death, and they learn from that. And if we do it the right way, they learn that death is not an enemy, but it's something that goes along with being alive. And so the loss of a pet is very difficult no matter what age you are, but I think it really helps children. They lose a pet. It's not grandma, it's not grandpa, it's not mom, it's not dad, it's not auntie, it's not uncle. But it's loss of something warm, furry, and cuddly. And no matter what, it's part of life, and that introduces them to a sequence of events that they're going to be challenged with all throughout their life. And I think that's what I see in veterinary medicine when we put an animal to sleep. When an animal comes in, a lot of times people bring an animal in and it's dead, and they say, "Can't you do something for him, doc?" You're tempted to say, "Well, I'm not God, I'd like to breathe life into him," but you can't. So you have to go along with what they're feeling. They're denying that this animal that's dead is dead. And so we try and work with that, and I think Dr. Hossain can probably add to that.
Well, there are the perception about that, it varies with the ages. For example, 3 to 5 years old, probably they may not aware of what that means. They may think that is irreversible.
Right.
Okay?
It's not permanent.
But as you grow older, then they begin to realize that that is irreversible. However, when your pet dies, it doesn't matter, either children or adult. We all will grieve, and however, for children, it prepares them for the future. Okay, how to deal with the losses. Okay, even though it's a pet, but they were very close to it, and they have different memories. They keep the toys and so forth. In the future, as you know, that as we grow older, we will keep losing, our parents, our grandparents, and so forth. So it definitely helps kids to prepare for the future losses.
Well, let me ask both of you, how does a parent prepare a child for the fact that puppy, whom you've known for so long, is going to have to go to sleep now? How do you do that?
Well, Dr. Hossain.
Well, definitely it's very, very difficult, when and at the time might come, then, you have to put your dog down or your cat down. It's traumatized everyone, not only the children as well as, adults. However, it is always good to be honest with children, that, hey, listen, it is probably better that instead of suffering from whatever the illness, it can be diabetes or some other cancer or some other serious illness, probably he will be in a better place instead of just suffering. Okay, so it is always, I always advise, be honest and truthful to your children. Probably say in a nicer way, in a different context, but try to always tell the truth.
I agree with what Dr. Hossain said. I think another aspect to this is there is the death, there is the grieving. Let's make the grieving and the depression and the upsetness healthy. This is how you deal with this. Many children today get upset by a gun, shoot people, go and throw themselves off things because they've lost their girlfriend, they've gotten a bad grade. I can remember in university, many people have done, well, we call suicide a permanent solution to a temporary problem. And those kind of things establish themselves early in life. These people have to learn, the children, have to learn how to deal with confrontation in a positive way so that they can move on in their life and take in challenges, learn to deal with challenges, fight against challenges, and move on. And the death of a pet is one of the first challenges that they have, and they have to learn how to deal with that in a healthy way. They do have to learn how to deal with it, as Dr. Hossain said, in an honest way, but also they have to learn how to develop skills to get through it.
I completely agree with Ernie. You know, I can give you a story about, you know, I was working down the shore somewhere in the Lakewood area, and one patient came to me. She's a middle-aged woman, you know, single, and she came with the symptoms of severe depression. So when I was talking to her, getting the history, that you know, I asked her, so what's going on with you? She says, you know, just recently I lost my dog. I had this dog for 13, 14 years, you know. So, well, you know, I was trying to, you know, treat her, you know, therapy and plus medication. She was not getting better.
No.
And probably, you know, couple of months, and one day her sister came to me, you know, came with her. I said, Doc, what you doing? I don't know. She's not getting better. So kind of, you know, then I said, you know, I'm probably not targeting the, you know, right thing, and that's why she's not getting better. So I asked her a little bit, you know, her background, her story, and then she said, you know, that when my mother died many years ago, I didn't cry. But after my dog died, I started crying, you know.
Guilt.
So sometimes we call it, you know, complicated grieving, that I will always tell that, you know, when there is a loss, grieve. If you have to scream, if you can't scream, go to the bathroom, close the door and scream, because it's going to help you. It's a healthier way to ventilate your feelings and express your feelings healthier way.
Absolutely.
I totally agree with, like you said, that, you know, with the loss of your pet, you grieve healthier way. It will prepare you for the future, that if you break up with your boyfriend, I'm a psychiatrist, I see all the time. So what brought you here to the hospital? Well, I broke up with my girlfriend, I felt life not worth living, and I took a whole bunch of pills to kill myself. You
Aspirin or something non-lethal.
So it means that the kid was not ready to deal with the losses.
Mm-hmm.
You know,
Didn't have the skills.
Correct.
Didn't have the skills to deal with it. And that's one of the best benefits of having a dog. You get skills on how to communicate, skills on how to interact safely and professionally or comfortably, skills on how to have someone in your bed around your person without interfering with them and without letting them interfere with you, but you can still live and be happy. And those are all the skills that a pet gives you, whether it's a dog, a cat, a goat, a pig.
Correct.
They will all give you those skills.
I'd like to turn, before we close tonight, to pet therapy, if we could. I'd like to focus on that a little bit. I understand that Somerset has a pet therapy program, is that correct?
Yes, we do.
Could you explain some of the,
Sure.
tell us about
Sure.
that?
You know, we have about 14 beds at Somerset Medical Center. It's an inpatient facility, and we do have volunteers who bring their dog, especially dog that's most likely allowed in the hospital. And I see these people are so depressed, they are isolative and withdrawn, they are not talking. When they see the dog, they're all kind of so involved with the dog. They go and talk to the dog, they try to pet, you know, it brings kind of life to them, you know. So it's definitely, you know, when they're lonely over there and they see the dog and they feel much better. And I've seen they're more talkative and smiling and happier.
Is that something that you almost prescribe as a physician? Or is it just sort of a supplement to their care?
It is a supplement. We do not prescribe that.
Okay. Is it something that that you do regularly, or is it only when a volunteer happens to come in?
We do have almost every week, few times in a week, we see that volunteers come and help our patients with the pet.
And if I can just interject here, a therapy dog is not just a dog you take from your home and take it into a hospital. As a veterinarian, we have to examine the animal, make sure he's healthy, free of parasites. But these dogs go through some rigorous training and rigorous testing before we can allow them to go into the hospital. Many dogs fail. So it's not just, I have a cocker, I'm going to take him in. It's, you have a dog, you go through a series of testing, you get your dog certified now. When I did it in '87, there was no certification. It was the first time it had ever been done. But now, so in some cases, it's set up by the hospital, by the administration, to help people on all wards. It's not a thing that a physician would prescribe. It comes in and the physician decides whether or not his patient would be appropriate for that kind of interaction.
Is there a particular kind of pet that's better? For example, a particular kind of dog. Does a dog, first of all, behaviorally, does a dog have to be a certain kind of animal?
Most of the time that what I've seen, I mean, and you can add to that, you know, like probably I have seen golden retriever, I've seen quite often. We have in our facility that's Portuguese water dog, and I've seen a greyhound, okay, and probably Newfoundland. Yeah,
it's really the dog's personality that makes it a therapy dog. It's the dog understanding that this person needs someone to just, I enjoy being touched, and I'm going to go over there and allow him to touch me. I'm going to make that connection. I'm going to make that bond. It's a very special thing that I can't describe, I can't define, but it's a very special thing. But let's not just limit our conversation to dogs. There are people who take ponies into hospitals, and people who take people to dolphins, and people who take goats and sheep and cats. I don't want to forget about my cat, but cats into hospitals. But it's the personality of the animal that makes that up.
Okay, we've run out of time. So I want to thank both of you, Dr. Rogers and Dr. Akhtar Hossain, on talking about people and their pets and the psychiatry thereof, and thank you very much. I'm Jim Horton, and thank you for watching.